Hi there, this is Emmy Vadnais. I am an occupational therapist who specializes in complementary and integrative health, wellness, and prevention. And I'm also the leader of the holistic occupational therapy community. I want to say thank you for being a full member of the holistic OT community. And part of your membership is that you get to receive monthly tips and suggestions about using complementary and integrative health in occupational therapy practice. So one of the questions that I get asked a lot, or a lot of people are really trying to, find out, the answers, is around documentation and billing. And so I just wanted to take a few minutes to just share with you some tips and suggestions on what I think might help you with your documentation and billing. This is not meant to be a full comprehensive class, but I think that what I share with you will get you well on your way to feel more confident with using some of these ideas that I share with you for your documentation and billing. And just know that I am available for consultation if you do have any follow-up questions. And yeah, I'm excited to share this with you, and do give me feedback on how this was and if this was helpful for you or not. And also, if there's any other topics you would like to learn about or any other tips and suggestions you would like, I've certainly, as you probably have seen, put together a lot of classes. And I'm also happy to just share, these tips and suggestions once a month in maybe 10 or 15-minute segments, or answer some of the questions that I'm frequently asked. So let's go ahead and get started. So first of all, when thinking about whatever it is you want to provide for your client, for your documentation and billing, I think the most important thing is to take a moment and just recognize, do you feel confident in the skills or the techniques you want to provide? Do you have enough education? Do you feel ethically that you can provide this for your client? I know with some of these approaches that some people have taken classes and some people maybe have just read some information. I think it's really important to feel that you do have the confidence, and I know that's, as we're first learning something, confidence comes with practice. But I would really encourage you to have done some basic, intermediate, or maybe even advanced training in whatever complementary integrative health approach you want to offer. And there's so much great education out there now in that regard. And also to look at the OT with complementary health approaches and integrative health position paper that's put out by the American OT Association. It was last updated in 2016. It's located on the AOTA website under official documents. And I've also posted it on the Holistic Occupational Therapy group on Facebook under files, I believe. And you want to also make sure that the approach that you're providing is part of an OT comprehensive plan of care. So that means that you have assessed the client, that you have looked at whatever it is the client is seeking your services for, or you've been referred to for, under an OT lens, and perhaps you've used whatever evaluation you've used, and that you feel that this complementary and integrative health approach would support their plan of care. Some OTs are dual trained or multiple trained in other professions in integrative health or other techniques, and some will use those approaches standalone. For example, maybe yoga, massage, craniosacral therapy, or energy healing. And when you're just solely using those services, you're not really providing OT unless you are using those services as part of supporting your client with a plan of care. And I think that as we go forward, some of these areas are not always completely black and white. I think it's kind of getting flushed out as time goes forward, and as really integrative health just becomes part of healthcare. But, for example, those of us who do provide prevention and wellness, for example, I do in my practice, that, we're not getting that reimbursement from the insurance companies, and also that the way that we're providing our care is not really that, date of injury or showing a deficit that we're improving upon. It could be that we're really wanting to help them maintain their wellness or improve and have a more healthy lifestyle so that they can live their best life for as long as possible. So Let's see here. I want to go ahead and just share with you some tips for your documentation and billing. As far as I do have a sample long-term goal and SOAP note I want to share with you, and I also, let's see, want to talk about billing codes just a little bit as well. Also, do look at your state laws as far as what you can provide. For example, I think there are some state laws around nutrition that are really clear about who can provide support around nutrition. So know that what you're providing is something that you can provide under your OT license in your state. So as far as when you're working with your client, one of the things that I tend to focus on a fair amount with my clients is stress reduction. And of course, there's many interventions that I might use to help them with that. But really, when we think about, people making healthy lifestyle choices, lowering their pain, their emotions, being able to even participate in therapy or rehab, that if they're not feeling well or their emotions, they're feeling depressed or sad, and perhaps, and probably rightfully so, they might be going through a really hard time, that if we can help them get into that relaxation response state, there's a lot more that we can do with them. So as far as documenting their outcome in a session from a more, I guess, subjective, but also kind of giving a rating scale, I like to use the subjective unit of disturbance scale. So scale from 0 to 10 on pain, stress, anxiety, maybe their emotions. And so I will have them rate that, when they first come in or when I'm talking with them and kind of getting set up of what we're going to do. And then after the intervention, I'll ask them what their level is at, and it is usually down. Very rarely does it go back up or stay the same. But that's nice to be able to include in your notes. And also, you can document any education you provided. So for example, if somebody is staying on that stress reduction, maybe I'm teaching them some relaxation techniques that I can share that I've instructed the client in using, and I think I'll share that in the SOAP note here as well, that I provided education to the client about using this relaxation technique or meditation, and that they plan to practice it maybe 3 times a week for the next week for 5 minutes or something like that. And how it is helping their ADL performance. And also if you provided any caregiver education, which sometimes I do with parents, or if you're working with the elderly, you might do that with their children or family members. So I do have this sample long-term goal here and a sample SOAP note to support that. I'm just going to go ahead and read this. You can pause your screen. This comes from a sample. The sample comes from the webinar that I did for the American OT Association, OT with Complementary Health Approaches in Integrative Health. That's up on their website and is available as I guess a download, or you can watch that webinar through them for the next 3 years. It's been up for 1.5 years now, and it'll be up for a total of 5 years. So definitely check that out, and that talks about how to use complementary integrative health approaches in occupational therapy practice. That'll give you even more information and more confidence with using this. But one thing that I didn't go into a lot of detail in there, and I think just because the laws are different state by state, I wanted to share a little bit of that with you now about the billing as well. But first, let's go ahead and look at this long-term goal. So by 6 weeks, client will be independent in sleep hygiene program with relaxation techniques as evidenced by staying asleep throughout the night. Client will independently shop for groceries with reports of only minimal anxiety, and then I give a date for an example here. By the last visit, client will demonstrate the ability to plan and cook meals following the healthy eating recommendations by his nutritionist. So as OTs, we're really not meant to give a specific diet or nutrition plan to a client. Now, certainly if you have extra training in nutrition or you're a nutrition coach, but again, I think it's important to talk with the team around that and their primary healthcare provider, because there could be more going on with the client, and that's not really our role. But we can certainly share with people how to eat more healthy, how to make more healthy choices in general. Perhaps there's some research or education you want to provide to them But that's not really our role, is to go through those kinds of specifics. So the SOAP note reads, the S, I'm still having difficulty thinking about shopping. I get so nervous even thinking about all the people in the store. And then the objective is, client participated in a treatment session consisting of 45 minutes of therapeutic activities for anxiety reduction prior to completing a simulated shopping experience. Skilled therapeutic activities consisted of progressive relaxation, special place imagery, and preparatory method of foot reflexology for 10 minutes. Following preparation, the client reported reduced anxiety level from 6 to 2. Level 2 was maintained through virtual shopping task, which allowed her to participate for 20 minutes without symptoms of anxiety. Client has improved from previous sessions as she can now participate in virtual shopping experience longer than initial 10 minutes. Skilled intervention of OT practitioner continues to be required for education and anxiety-reducing activities that can be completed independently, such as abdominal breathing and progressive relaxation. And the assessment, client reported that anxiety decreased and maintained a 2 out of 10 through simulated ADL activity. Overall gains are being made. Client is able to maintain state of physiological relaxation when dealing with stressful situation shopping simulation. And the plan is for the client to continue with the current plan of care, and will plan outing to the grocery store during next session to be executed within 2 weeks. There is a new course, or newer course anyway, from AOTA on documentation, and so I think that it's important, when you are working with insurance companies and Medicare as well, is to have that skilled therapeutic activities, skilled services still needed, and so forth, so that, if OT, skilled intervention of OT practitioner continues to be required, etc., for that reimbursement. And I think, my opinion is, I think it's really important to mention what intervention you're using, integrative health intervention. So for example, if you're providing yoga, to mention yoga. I know some practitioners will mention stretching and range of motion exercises. It's certainly up to you if that's the route you want to take for working with your insurance company. But I think the more of practitioners are talking about what the actual modality is and not trying to cover up what it is, that I think the more that these approaches can be accepted, myofascial release, craniosacral therapy, those kinds of things as well. So I hope this gives you a good little sample of a long-term goal and a sample SOAP note of how you can work with your clients with these interventions. I think most of you will probably find that that's, or I would say probably all of you would find, oh, that makes sense. That seems pretty straightforward, not so complicated. And then as far as using codes, I just want to give you some examples of codes. Now again, this might be different in your neck of the woods, so this isn't meant to be 100% accurate. I hope it is. I very rarely have heard of anybody getting denied, but when they do, I think it's important to go back to the insurance company and explain how you as an OT are trained to use this intervention, why it's supporting your client, and how it has benefited them. And I think that the more that we do that, the more that this will be accepted. Again, I hear very rarely of people being denied, but if that does happen for you. So some of the codes that could be used for relaxation, meditation, or guided imagery could be therapeutic activity or self-care, or perhaps even for memory or enhancing cognition, it could be cognitive retraining. And also, I mentioned the self-care and the ADL code because really when we think about, if you do have a regular relaxation or meditation practice, that, that's really like brushing our teeth. That really is an ADL. I know it is for me in my life. Certainly that's a daily practice for me to do my yoga, my meditation, my prayer. In the morning, that really just sets the tone for my day nicely, and it's something that I come back to over and over again throughout my day, particularly when working with clients, because I need to, not only for me, for my self-care, and not only for, being able to do the work that I do, but it does, enhance how I'm working with my client as well. So a few other examples here for billing. Manual therapy or body work could be under the manual therapy code. Nutrition, diet, or healthy meal planning could be self-care. Yoga could be therapeutic exercise, therapeutic activity, self-care, ADL, or cognitive retraining. And energy healing could be under therapeutic activity, or if you are, which I often do with my clients when I'm providing energy healing, I'm explaining to them how I'm working with their bioenergetic field and how they also can work with it, for their self-care as well. So that can then be billed under self-care or an ADL. Tai Chi, for example, could also be an ADL or therapeutic exercise. So those are just some examples. As far as reimbursement, most of my practice is private pay at this time, and you might also, all of my clients pay with cash, and I do sometimes do billing through a health savings or flexible spending account. So if any of you are working at a clinic or have your own practice and want to make it more accessible for people, that offering that can be really nice as well. And then of course with those HSA accounts, being able to provide whatever, I just ask the client to ask the company what it is they need from me as far as like diagnostic, like whatever the primary diagnostic code would be, or usually I'm mentioning that I'm helping them with stress reduction. Maybe it's for sleeping, maybe it's for eating better, things like that. And then because I am cash-based, I do offer that when people pay for multiple sessions or schedule multiple sessions, that I do offer a discount for them. So I hope that helps. I'm trying to think if there's anything else I wanted to share with you before we wrap up here. Let's see. Yeah, I think that's really it for now. So again, if you do have any more questions, certainly let me know. I think that, when I think about over the years, all the people asking questions about documentation and billing, I really feel like I've whittled this down really pretty simply. Please don't underestimate what I'm sharing with you, that it's, as far as the quantity of minutes that I've been talking with you, I really think that the quality of what I put together here should be helpful. Again, just to review, to, think about what it is you're providing. Do you have the proper education? Do you, are you within your state laws? Have you looked at the OT and complementary health approaches and integrative health position paper put out by AOTA? It's on their website under official documents. I've also put it up on the Holistic Occupational Therapy group on Facebook. Do you feel that you have the competency to provide this approach? And if not, what education are you wanting to seek out? And let's see, it must be part of a comprehensive OT plan of care. I've shared with you a sample long-term goal and SOAP note. And I think that's pretty much it. So with that, I will say thank you again for being a full member of the Holistic OT community. I look forward to sharing whatever more tips and suggestions you might be interested in. And please do check out the classes that I'm offering. I know it's beginning of June here of 2018, so I'll be offering more classes in the fall. I do have a holistic healing certificate program that I'm offering and have been offering for a number of years. A free info session on September 15th of 2018 that you can sign up for if you'd like to learn more about that. So with that, thank you so much for listening, and please do share with your friends and colleagues about the Holistic OT community. It's only $5 per month to be a full member, and I really would like to keep providing, as long as the OTs are interested in learning more about this, I want to continue to have this platform. And thank you so much for continuing to support the Holistic OT community. This is Emmy Vadnais, and bye for now. Thank you so much.